Hello children, in this video we are going to learn chapter 21 Health and Disease. In this lesson you will understand the type of abuses and associated behavioral change and know the cause for drug, tobacco and alcohol addiction and its effects on health, and you can analyze the possible way of de-addiction and know about the diseases and disorders associated with lifestyle modification, and you can compare the features of type 1 type 2 diabetes mellitus and relate the sign and symptoms. You can understand the cause and symptoms for obesity, heart disease, cancer and AIDS, and you can get remedial measure for prevention and control of these diseases and disorders. Abuse. Abuse refers to cruel, violent, harmful, or injurious treatment of another human being. It includes physical, emotional, or psychological, verbal, child, and sexual abuses. Abuse can occur within the family and with people who are not associated with the family. Child abuse constitutes all forms of physical or emotional ill treatment, sexual abuse, exploitation resulting in child's ill health, survival, and development. Physical abuse of a child is defined as those acts that cause physical harm, such as threatening, beating, kicking, and hitting the child. Sexual harassment is a form of power and dominance of one person over another, which can result in harmful consequences to the victim. Adolescent girls and women encounter sexual harassment in different forms. Sexual abuse is more common at workplaces. Verbal remarks, comments, gestures, and looks are the most common form of abuse. Sexual harassment results in psychological distress and eating disorder, physical illness in the affected individual. Child sexual abuse. Children are considered soft target for sexual abuse because they may not realize that they are being abused. Commonly, abuser or persons well known to the child may even be living in the same locality. Abusers also bribe to lure children and take advantage of the child's innocence. Sexually abused children show symptoms of genital injury, abdominal pain, frequent urinary infection, and behavioral problems. Approaches for protection of an abused child. Child Helpline. The Child Helpline provides a social worker who can assist the child by providing food, shelter, and protection. Next approach, counseling the child. Psychologists and social workers should provide guidance, counseling, and continuous support to a victimized child. Family support. The victimized child should be supported by the family members. They should be provided with proper care and attention to overcome their sufferings. Medical care. A child victim of sexual offences should receive medical care and treatment from healthcare professionals to overcome mental stress and depression. Legal counsel, rehabilitation, community-based efforts are also the approaches for protection of an abused child. Legal counsel. The family or the guardian of the child victim shall be entitled to free assistance of a legal counsel for such offence. Rehabilitation. Enrolling in school and resuming their education is an important step towards rehabilitation of the child. It is essential that the child's life is gradually returned to normal after the incidence of abuse. Next, community-based efforts. Conducting awareness program among parents, school students and public on child abuse and its prevention. The Ministry of Women and Child Development championed the introduction of the protection of children from sexual offences, that is POCSO Act 2012. People who traffic children for sexual purposes are also punishable under the provision relating to the Act. There are objectives of the POCSO Act 2012 to protect children from the offences of sexual assault, sexual harassment, pornography, and to establish special court for speedy trial of such offences. The National Commission for Protection of Child Rights, that is NCPCR, was set up in March 2007 under the Commission for Protection of Child Rights Act 2005. This act emphasizes the principle of universality and inviolability of child rights and recognizes the tone of urgency in all the child-related policies of the country. Protection of all children of all age group up to 18 years of age is of equal importance. Policies define priority action for the most vulnerable children. There are some steps taken to prevent child sexual abuse. As a parent as well as teacher should instruct the child not to talk to any suspected person or strangers and also to maintain a distance and not to be alone with unknown person. And we should instruct them to be careful while traveling alone in public or private transport. We should instruct them not to receive money, toys, gifts or chocolate from known or unknown person to them without the knowledge of their parents, and not to allow known or unknown person to touch them. It is the responsibility of every individual living in a society to ensure a safe and protected environment for our children to enable them to live with dignity and free from any form of violence. Next, drug, alcohol and tobacco abuse. The physical and mental dependency on alcohol, smoking and drugs is called addiction. The addictive potential of this substance pulls an individual into a vicious cycle leading to a regular abuse and dependency. This is of serious concern because abuse of tobacco, alcohol or drugs produce many harmful effects in an individual, to the family and even to the society. This dangerous behavior pattern among youth can be prevented through proper guidance and counseling. Drug abuse. Drugs are normally used for the treatment of disease on advice of a doctor and withdrawn after recovery of disease. A person who is habituated to a drug due to its prolonged use is called drug addict. A drug that modifies the physical, biological, psychological or social behavior of a person by stimulating, depressing or disturbing the function of the body and the mind, that is called addictive drug. These drugs interact with the central nervous system and affect the individual physically as well as mentally. Types of drugs. There are certain drugs called psychotropic drugs which act on the brain and alter the behavior, consciousness, power of thinking, and perception. They are referred as mood-altering drugs. Person who live without drugs. The condition is referred as drug dependence. There are two dependence: physical and mental dependence, psychological dependence. Dependence on the drug for normal condition of well-being and to maintain physiological status, physical and mental dependence, and feel that drugs help them to reduce stress is psychological dependence. Behavior changes of drug users. Drug addict or lack interest in studies, so absence from schools or college. A lack of interest in personal hygiene. Always in the mood of isolation, depression, fatigue, and aggressive behavior. Avoid the relationship with family and friends, and they will change in food and sleeping habit. Lack of hungriness, so fluctuation in body weight and appetite. Always looking out for an easy way to get money for obtaining drugs, and prone to infections like AIDS and hepatitis B. June 26, International Day Against Drug Abuse and Illicit Trafficking. Narcotic Drugs and Psychotropic Substance Act was introduced in 1985. How to overcome drug abuse is called drug de-addiction. Management of de-addiction is a complicated and difficult task. The path to recovery of drug addict is long and often slow. The first de-addiction process is detoxification. The drug is stopped gradually and the addict is helped to overcome the withdrawal symptom. The addict undergoes severe physical and emotional disturbance. This taken care by specific medication. The next de-addiction process is psychotherapy. Individual and group counseling is given by psychologist and counselor. The treatment include efforts to reduce addict stress and thought new way to solve everyday problems, adequate diet, rest and relaxation. Counseling to family members. Social workers counsel family members in order to change the attitude of rejection so that the addict is accepted by the family and the society.